Friends, I'm Komal Yadav and today I'm going to tell you about the radiology. Radiology it is the branch of medicine that deals with the radiant energy in the diagnosis and the treatment of the disease by using the images technologies. This field can be divided into the two branches. First one that is the diagnostic radiology and second one interventional radiology. Firstly, we discuss the diagnostic radiology. In diagnostic radiology uses the medical images such as X-ray, ultrasound, CT scan and MRI to diagnose the disease anywhere in the body. What is the medical imaging? Medical imaging it is the visualization of the body parts, tissue, organs for use in the clinical diagnosis, treatment, and disease monitoring. Images technology contain the fields of radiology, nuclear medicine, and the optical imaging. Diagnostic radiology contain neuroradiology, pediatric radiology, breast imaging, cardiovascular radiology, chest radiology, gastrointestinal radiology, genitourinary radiology, musculoskeletal radiology, emergency radiology, and nuclear radiology. Now we discuss the radiology techniques. X-ray radiography, fluoroscopy, CT scan, MRI, positron emission spectroscopy, ultrasound, and the single photon emission computerized tomography. Now we discuss the ultrasound. What is meant by the ultrasound? High frequency waves is used for the visualize the soft tissue structure present in the body. Ionizing radiation is not used in this type of the radiology, but the quality of the images are obtained by using the ultrasound waves. It depends on the high skill of the person performing the exam. Ultrasound wave use the acoustic energy above the audible frequency of human in order to produce the images. As there is no ionizing radiation with the modality, it is particularly used in the imaging of the children and pregnant women. Now we discuss the CT scan. It refers to the computerized X-ray imaging produced in which a narrow beam of the X-ray is aimed at the patient and quickly rotated around the body. Produce the signals that processed by the computer machine to generate the images. Now we discuss the nuclear medicine. It is the branch of medical imaging that use the small amount of radioactive material to diagnose and determine the severity of the disease. It include the many types of cancer like heart cancer, breast cancer, gastrointestinal cancer, endocrine cancer, and other abnormality in the body. Most common nuclear medicines modulate to use in the clinical practice, that is SPECT and PET. Uses of the CT scan. It used to diagnose the muscle and bone disorders, pinpoint the location of the tumor, clot formation, guide the procedure such as the surgery, biopsy, and the radiation therapy. It detect and monitor the disease condition such as the cancer, heart disease, lung nodule, and the liver masses. It monitor the effect of the certain treatment such as the cancer treatment. It detect the internal injury and the internal bleeding. Now we discuss the source of images. It is the structural and anatomical images. For example, CT scan, MRI. It contains the each elemental volume and the tissue differentiating measurements and the information of the functions of the PET, SPECT. Now we discuss the projection radiography or the X-ray radiography. Radiographs are produced by transmission of the X-ray without added the contrast material such as barium and the iodine patient to capture device and then convert into images for the diagnosis.